A small sex advice for people with chronic pain. Sexual intercourse can cause discomfort to people living with long-term pain. But living with chronic pain should not mean that the pleasures of sexual activity are beyond your reach. Sexual activity, when comfortable, can provide some amount of temporary relief from pain. The key is to go back to some form of sex as soon as possible. The longer you avoid it, the greater the fear of resuming sex, and a downward spiral can be put on. In addition, a loss of intimacy can separate couples and hurt their long-term relationship. Plan ahead for sex. If you live with chronic pain, spontaneous sex will never be easy. Planning and preparing for sex may not sound romantic, but it is a better way to achieve a satisfying sex life. People often experience more pain at certain times of the day. So you can help have sex when your body is at its best, when your muscles are the least painful and your not so rigid joints, and when you're less tired. Many people are more intimate just before going to sleep at night, but for people with chronic pain this may be the worst time. Instead, plan to spend time with your partner in the afternoon, or any time of a day you feel the slightest pain. Tips for a more comfortable sex. If you take medication to control your pain, try to measure sex when the therapeutic effect of your medication is at its peak. Experiment with different positions that decrease physical stress, such as lying side by side. It can help warm up the bed in advance with an electric blanket to relieve muscle and joint discomfort. Also, do some soft stretches and use polyester or silk sheets to make it easier to turn and move in bed. Alternatives to intercourse. If intercourse is not an option, there are alternatives such as masturbating each other, oral sex, sex toys. Do not underestimate the pleasure and sense of intimacy you can get from touch and be touched, petting, massage, kissing. For example, you could take a shower together or massage each other in turn if one of you has a bath. Talk openly with your partner. Talk openly and honestly with your partner about how pain affects your enjoyment of sex and what you want from your relationship. Choose the right time to have this conversation. It may be better to talk about it during dinner or walking, for example, rather than being in bed or in a intimate situation. When to get help. If your pain is so severe that it is affecting your ability to have a satisfying sex life, talk to your doctor. You may need a different or stronger pain management plan. Some types of medications have side effects that can affect your sex drive and your ability to have sex. Your doctor may recommend an alternative or your current medication. If necessary, your doctor can refer you for professional sexual counseling.